this, and then he will get like that, and then he'll do like this.
Yeah.
His hands will be like this.
Yeah, I
terrible
understand.
pain, and then he will. By the
Then
time
release
he
myself.
straightens up, it will be so painful when we are sitting and watching, and then he will like wobble because he's trying to keep that balance. Not
Then
to
I can squash.
And many times we'll say, what's happening? He will do like that, and now.
Because of the compression of the nerve.
Hi guys, very good morning. If you're somebody who has low back pain and you've tried exercises, medications, physiotherapy, and your low back pain is still persisting and it is not allowing you to do your activities of daily living or exercising, and you want to get rid of it, this is the video for you. So now, coming straight to his MRI scan. So if you see, this is your brain, and the spine is the tail of the brain. So if you see, the whitish structure which arises from the brain is your spine. Now just before the spine, again, this is the abdomen and this is your back. So before the spinal cord, if you see these blocks which are here, the white blocks, these are the vertebral bones. And the darkish lines which are in between the bones are your discs. So if you see, he has a disc bulge at the cervical spine at 2 levels. But fortunately for him, he does not have any symptoms there. As we go down to the lumbar spine, as you can see, this is numbered as L5. So this will be L4. So if you notice the disc above, you can see that the position of the disc is well within the level of the bones, and it is not compressing on the spinal cord. Whereas if you see here, this disc has come out and it is compressing the spinal cord. This is known as a disc bulge. Now, in his case, the bulge is not too significant or too severe, but he still has symptoms of radiculopathy. If you see the spine, okay, this is a motion segment of the spine. So if you see, these two are the vertebral bones. So he has a disc bulge in L4 and L5. What happens in a disc bulge is, when there is excessive pressure, the disc comes out like this, and that compresses the nerves which are coming out of the spinal cord, and the patient has pain in the back and also pain radiating down the legs. For him especially, even though the disc is not very severely bulged, his symptoms are quite significant. So for him, we are not planning to do an open discectomy. What we are planning to do is a minimal access procedure known as a nucleoplasty, and we will be augmenting it with regenerative cells in order to heal the disc completely. So the process is, if you see, this is how the spine will appear, and we access the disc from the skin through this space known as the Cambin's triangle. And once we enter the disc, we remove whatever excess is there, and then we come out. And in the region of the disc where we have removed the substance, we go inside again and inject healing cells there. So what are the healing cells we add? The healing cells we add are 1. Mesenchymal stem cells from the bone marrow. Basically, we harvest bone marrow and concentrate the cells in the bone marrow, and we mix it with platelet-rich plasma. A lot of you would have heard about platelet-rich plasma for the hair. It is a very similar composition, but the concentration of the healing cells or the growth factors is much higher in musculoskeletal grade platelet-rich plasma. So we mix the mesenchymal cells from the bone marrow and the platelet-rich plasma together and deliver it in the area where we have removed the disc from. After that, we also deliver a few cells in the area of the nerve root, because that was the area which was previously compressed by the disc. So even though we remove the disc, the effect of the compression would still be there, and delivering the healing cells in that area definitely improves healing. After this procedure, the patient can actually walk within 4 hours. There is no incision, and we start rehabilitation exercises within 24 hours. The key point here is, if you have a spinal issue, especially if it is related to the disc, you will have to exercise continuously and strengthen your back irrespective of what the interventional treatment is. What I mean is, if we treat you with surgery, open surgery or minimal access or ultrasound guided procedures, when we repair the issue, you still have to exercise, because remember, you have 30 discs in your spine and we are only setting one level right or two levels right. So in order to protect the rest of your levels, you definitely have to start exercising regularly, and I would say 4 days a week is good, specifically to strengthen your spine.
Before the surgery, I had a lot of problems in walking. I found it very extremely difficult, and I was sort of tending to walk on the one-sided, and I had pain, down the lower back, and it was very inconvenient even to get up, to stand up, and my entire hands and legs will become stiff. But after the surgery, I'm finding it so convenient, and it's become so easy for me now by the grace of God. And I'm really thankful to God for this procedure which was done on me. Yesterday I was discharged, and from yesterday till now I'm doing great, and I really am happy about it. So I feel more relaxed and more comfortable and more strong on my feet. I'm not wobbling and all that stuff. One thing I honestly would like to say, that the entire lot of people whom I met were such wonderful people, from the office and even to the nursing staff and even the doctors, the anesthetist, everyone who really came to see me and do something for me, all of them did a fantastic job. I am looking forward to, leading a very normal and beautiful life. I know that I'll have more confidence to do my walks and do everything normally without any problem. And I'm looking to another 10 years of living life to its full by the grace of God.
Actually, when we were told about the non-invasive procedure, I was like happy in my heart for him, because I know I don't want to put him through much of pain and suffering, and recovery time will be a little prolonged, but I didn't want all of that. So I was very happy that this kind of a procedure was there and we could make use of it. Dr. Santhosh, when I called him and I told him that pastor is in this state, he said, "Auntie, just come here, I will take care of him." And he did. He kept to his word. He was so kind and thoughtful, and he took us, he gave foremost importance to pastor and his recovery and the surgery. I really like his approach and the way he put us through all of this, counseling, and then finally we did the surgery, and it is amazing.
I hope this was useful and interesting, and if you liked the video, press the notification button, subscribe, and also share if you feel somebody you know will be benefited. And also guys, I know that a lot of the stuff which I talk about is quite complicated. So in order for you to clarify any of your doubts, go to my website, it's right here, and log in your questions. I will make sure that I answer each and every one of them. Alright guys, bye-bye. See you. Signing off, Dr. Santhosh Jacob from the city of Chennai, Tamil Nadu in India.
Click Book an Appointment. Select a specialization. Select date and time. Fill up personal information. Select your mode of communication and submit. Fill up your payment information and select a payment method. And get treated at the comfort of your own home.